Hello, hello, hello. I'm Dr. Manon Fielding, and today we're going to be talking about menopause, anti-aging, and diet, and simple things that you can do that can help eliminate your symptoms and help start reversing your age at the same time. So these are the 5 most common patient diet mistakes. One, assuming that your choices are better than they actually are. And the reason for that is because we get information from a lot of sources that really are not accurate. They may be the way our family eats or does things, or from social media, or many different sources that may be based on old information or just accurate information. Second is being confused about carbs. There are a lot of different kinds of carbs, and people get very confused because we have our simple carbs like pastries and cakes and cookies and candy. I think most of us know what those are. We have different kinds of bread. So you have some breads that are high fiber and some that are not, like white bread. And then you have resistant starch and fiber, and those are 2 categories that are very confusing. So we're going to try to clear some of that up today. Third is eating too much, and that's a very common issue in our culture, basically in the United States. In other countries, people don't tend to eat as much and go out to get some ice cream, for instance. I remember in Paris, and they give you a little tiny scoop and you go, is that it? We get this big banana split, and that's the way we eat. Supersizing, right? The next one is excluding exercise. You might tell me, I eat perfectly, I eat really well, I don't know why I'm gaining weight. Well, maybe it's because you're not getting enough exercise. And 5, similar to number 1, believing everything you read about nutrition and weight loss. There's so much misinformation. You ask for advice from people who really don't know themselves. Maybe something worked for them, may not work for you, because everybody is a little bit different. Those are the 5 most common mistakes. We're going to talk a little bit about organic farming, and I think most of us know that eating organic is better for us, but why? One of the things that's really important to understand is that there's a very large decline in nutrient composition of our food. The calcium, magnesium, iron, copper, sodium, potassium, I forgot what that P is, phosphorus. There we go. So those are some of the minerals in our soil that have declined more than 40, 50% in some cases. But when you eat organic, the soil is taken care of a little bit better for the most part, and you will find higher amounts of those in the food. So that is a very important thing to consider. If you're buying all these fruits and vegetables and they have very little nutrient density, you have to eat a lot of them to get the amount that's your RDA that is necessary for us to have a healthy body. So the protein content in corn declined 30 to 50% between 1920 and 2001. What that means is that corn, like the corn that was eaten by the Indians and South America and here, was higher in protein many years ago, and now it's higher in starch, which is not the kind that we want. It's more like a simple carb. That's one reason why corn is not, a lot of people have allergies to it, because it's changed so much since it was developed. The ancients ate a lot of corn, but the corn that they ate was a lot different than what we're eating. Magnesium content of vegetables and wheat has declined up to 25%, which is why so many people are deficient in magnesium. A lot of my patients know that, because if you're low in magnesium, it affects your heart, it affects your joints, and it generally can cause a lot of symptoms. And then trace minerals in vegetable crops, including manganese, zinc, copper, and nickel, have decreased over the last several decades, but toxic minerals have actually increased, including aluminum, lead, and cadmium. So those are some important reasons to eat organic. Another important reason, not just for nutrient, is that pesticides can interfere with your hormones, and it has become very noticeable in women and men that are going through infertility treatment, that they have high pesticide residues in their body, and they have a higher incidence of having problems with birth and or getting pregnant to begin with. This is becoming a worldwide issue that fertility has significantly decreased both in women and men with their sperm count being decreased and viable sperm being decreased. And also this herbicide called atrazine is one of the most utilized herbicides in the United States, and it's an endocrine disruptor, meaning that it interferes with the hormone system in our body, and it can increase problems with your sugar balance. So you're, more likely to create diabetes and increase inflammation, which is also an epidemic in our society. Most of the women that I hear from have joint problems, which is all inflammation. This talks a little bit about how the atrazine is not only in the food that we eat, it's also in the water. Chronic and low dose atrazine decrease the metabolic rate, gaining weight because the metabolism was lowered, and increased insulin resistance, which has to do with more likely to create a diabetic situation. Then there is some other kinds of herbicides, and they have been found not only in food, but in diapers, in medical gauze that they use to wrap wounds in, and in tampons. So that's kind of scary. They have found some of the pesticides increase inflammation. That's been very common. And the long-lasting metabolic dysfunctions, increased risk of hypothyroid. So if you're a female, your risk increases for hypothyroid because of pesticides. As you get older, because I guess many years of eating and breathing and taking in these pesticides affect our thyroid over the long term. It affects the way we produce iodine, and iodine is necessary for thyroid. It is an endocrine disrupting chemical. There may be certain symptoms that you have that you think are menopause that could actually be thyroid. And many doctors, not all of them, but a lot of them do test for thyroid before they put you on HRT. But if you're on HRT and you're still having some of these symptoms, it may be because you have a hypothyroid. So sleep disturbances, hot flashes, depression, moodiness, weight gain, joint pain, and urinary tract infections can all be related to hypothyroid. Now, hypothyroid has many different gradations. It may be severe because it may have taken years for them to figure out what's wrong, or it could be in an early stage. And an early stage, you might be able to handle it with changes in your diet and supplements. But when it's more severe, then you're going to have to be on thyroid hormone. Okay, now we're going to talk about the nutrients that we had mentioned. There are three basic elements. There are macronutrients, micronutrients, and phytonutrients. Today, we're going to be talking about the macronutrients, which is your protein, carbohydrate, and fat, which are kind of the building blocks of your food. And the other ones are the micronutrients, are the vitamins and minerals. We're not going to be talking about that today. And phytonutrients are other positive parts of plants like herbs, about herbs and turmeric and different kinds of plant materials that seem to have a very positive effect on our body. Those are called phytonutrients. First, we're going to talk about the proteins. So we're going to talk a little bit about the proteins first. And they are, like I said, one of the macronutrients, and you have the carbohydrates, proteins, and fats. And here's an example of a whole bunch of protein: fish, eggs, nuts, chicken, turkey, fish, steak, sausage, got the whole gamut there. So what do dietary proteins do? What do they do for us? So one of them is that they're very important for growth and maintenance. So they help to repair body tissue. So that's essential because we're not really growing right now, but we definitely need a lot of repair. It helps with the enzymes, so facilitates chemical reactions. So it's very important with our DNA and continuing to repair RNA and DNA that we have the enzymes and we have the proteins to do that. It helps to build hormones. Some hormones are made of protein and some are not, but of course they're essential for us. And during menopause, even more important. Antibodies, they are part of our immune system, help to produce immunoglobulins that are essential for protecting us against all kinds of immune insults, colds, COVID, flus, viruses. Fluid and electrolyte balance. So the volume in our cells and outside our cells has to be kept at a certain measurements, and that electrolyte balance is very important to our well-being. Acid-base balance, so that acts as buffer. It helps us digest our food. It has to be at a certain level for us to maintain a healthy body. Transportation, so it transports fats and vitamins and protein and oxygen, so they're very important for transport. And energy, most people think we get all our energy from carbohydrates. That's not exactly true. Proteins provide a lot of that energy source. So you can see all the different functions that dietary proteins have, and that kind of makes them one of the most important things to have, the protein of all the essential nutrients in our body. And these are all the essential amino acids. And I just highlighted a few that are important because of menopause, that have tryptophan, that's really important for neurotransmitter that helps create serotonin, which helps to keep us relaxed. So that's one of the functions with brain function. And it helps to relieve migraine and depression. So when you're really low on some essential amino acids like tryptophan, one of the symptoms is depression. So that's something that we need to look at. Tyrosine enhances positive mood, and it's also an antioxidant, so we definitely need tyrosine. Valine is essential for muscle development. A lot of women, especially, but men too, lose muscle tone as they get older, mostly because of lack of use. And you need to have protein to build up muscle. Phenylalanine helps with memory and learning, and it also protects against depression, and it helps to suppress appetite. So if you don't have enough phenylalanine, you might not know that you're full. Serine is important for synthesis in the immune system, and like we talked about, that's essential for our good health. Taurine is important for our brain function. Threonine is also good for immune system and collagen, so that's going to be really important for healthy skin. And asparagine, which aids in balancing our state of emotion. And you'd be surprised, and we're going to talk a little bit more about that, but that people who think they eat enough protein may not actually be getting enough to handle all of those different functions in our body. So this is a recommendation, but right now they're saying that we might need even more than this, but an example of a 165-pound person would need 59 grams. So we're going to average that out to 50 to 75 that are necessary protein, and they should be 10 to 30% of your calories, of your daily calories. Nearly half of all the protein in the body is found in your muscles. And as muscle mass decreases, we need to do more endurance and resistance training to promote that health. And eating the high protein foods will help to incorporate that into the muscle and help you stay healthier in your body. I'm a holistic chiropractor also, and one of the things I notice is that people hurt their shoulders a lot as they get older because they don't have any muscle strength, and they pull the joints out of place trying to lift, even just carrying in groceries or trying to move some furniture, thinking that they can do what they did when they were 25, and they don't have the muscle mass to do so, and they may not be getting their protein. So that means that cereal, especially cereal by itself, may not be the best breakfast food. And here are some examples of how much protein is in different foods based on the calories. So chicken breast and turkey, a normal dose would be about 28 grams. So you want to try to get some kind of protein source at every meal. in order to make sure that you're getting enough. And like I said, in America, well, really all over the world, that people tend to eat things like donuts and pastries and things in the morning, and they don't get enough protein. So definitely add some source of protein in your morning. One thing that some people do is they might use quinoa, has higher protein than some of the 6 grams, chia seeds, higher than some of the other cereals, and you can add that to it. In 2022, they had a randomized control trial that having a high protein breakfast really helped your glucose levels all day long. So it helped to manage your blood sugar so you didn't have spikes. A lot of people don't realize that that helps to prevent the fatigue that a lot of people feel during the day, because you're not getting enough protein in the morning and your glucose is spiking, going up and down. Eating the protein helps to kind of balance that. So hypoproteinemia, meaning you're not getting enough protein. And one of the reasons is we don't have a lot of capacity to store it. So if you're not getting enough of it all through the day, then you may not have enough when you need it. Okay. There might be, try to do something during the day that requires you to use your muscles and use more protein, but you haven't had enough. You might not really be digesting and absorbing it. And that is very important when it comes to digestion, because so many people take antacids, and antacids cut down your ability to absorb and utilize protein. If you don't have enough stomach acid to digest, you're not getting it. You might be eating the protein, but it's going right through you and you're not really getting the use out of it. You might not have the proper enzymes. So some people, as we get older too, the pancreas isn't producing enzymes to digest. You might have to take enzymes with your meals, especially high protein meals. You might not have healthy bacteria. So if you've taken antibiotics, it kills the bad bacteria. It also kills the good bacteria that help with digestion. You might have to take probiotics. Your gut function may be compromised. I know I have celiac disease. I have to work really hard at my digestion because that's something I was born with, and I don't have great function. Age, a lot of this happens as we get older, which is one reason why in menopause women start having a lot of these issues. They may never have had it before, but a lot of bad habits that they've had throughout their life catch up with you at that time because the body is changing so rapidly. You might have compromised liver function. The liver helps to integrate the protein. And if you've eaten a lot of simple carbohydrates throughout your life, your liver may actually be compromised, and you might need to do some work on healing the liver with supplements and different dietary ways, like the cruciferous vegetables, cauliflower, broccoli, cabbage, have healing properties to the liver, and that may be something that could be helpful. What are some of the symptoms of not having enough protein, not having enough, but not absorbing enough? Let's put it that way. You might have an increased infection and illness, like during the year. Do you get sick every year? Do you get sick more than once a year? I haven't had any kind of cold. I never got COVID. I haven't had a cold or flu or anything for about 7 years. 7 years ago, I remember I had the flu one year when I started a new job and I was really under a lot of stress. But you know, that your body should be able to handle most insults from the outside if you're healthy on the inside. You may notice that you're having decreased muscle mass. Maybe your legs are getting thinner, your arms are getting thinner, swelling in your legs without understanding why. So that could be because of protein deficiency. Because what do we talk about, how some proteins help to balance the fluids in your body? And if you don't have that, you might notice an increased swelling. Slower wound healing because you don't have the proper enzymes and things to heal. And you need to make sure that you're getting enough, like I was saying, during the day. So there are animal sources. All of you are aware of what those are. Plant sources, which include different kinds of vegetables, like I was mentioning, the cruciferous vegetables. You also have food like tofu, tempeh, spirulina, different plant types of proteins. And some people just use like a protein powder that has a variety of different kind of proteins and add it to a shake in the morning. That can be very helpful. That might be an easy way. And then you have your nuts and seeds. I don't recommend dairy products because so many people that are older have problems with dairy. And so that's something you're going to have to evaluate with your healthcare provider. Okay, the next one we're going to talk about is fats and oils. These are in competition with protein as being the most important, because fats and oils have gotten a bad rep because they went for years, oh, you got to cut down on your saturated fat, you got to cut down on this fat because you have high cholesterol, blah, blah, blah. A lot of that, most of that was untrue. Let's talk about what they do. Fats and lipids are the structural components of all our membranes. All your cell membranes are made with fats, so very important. And they also are an energy source. They're your energy reserves, and they're stored in your body in the form of triglycerides. So they are very important molecules. A lot of times people have difficulties digesting fats and oils. We'll talk a little bit more about that. Fatty acids, they have 4 different classes of fats. Lipid just means fat. So fatty acids is a source of energy for your muscle cells. So that's obviously essential. You have your triglycerides, which, you know, your doctor's always measuring those to see how they are, but they're very important, and they do compose your fatty tissue, which we do need some fat. We just don't often need as much as we have. Cholesterol, which is an essential component of the cell membranes, like we were talking about, and also essential to make hormones. This is why for menopause, you have to have cholesterol. You have to have enough cholesterol because it's a precursor to all your hormones. And it also is a risk factor when it is not handled properly within the body. And I'm going to talk about that in a minute, but it can also build up in the blood vessels. That's what I'm trying to say. So your blood doesn't go through as well, but it's not the dietary cholesterol that's usually the problem, usually because of too many carbohydrates and not having a good balance in your body, that cholesterol gets put down into the blood vessels. And phospholipids is another component of the cell membrane. So lipids, all very important to our health. Fatty acids function to control our blood pressure, control our blood clotting and inflammation in the body. So we talked about how proteins were essential for that. And so fatty acids have a role for storage and insulation. So like we were saying, it's part of our energy reserves. We need them for the healthy skin, hair, and nails. And if you don't have good nails, you don't have good hair and skin, it may be because you're not getting enough of the right kind of fats. Fat helps in the absorption and transport of all the fat-soluble vitamins, which includes vitamins A, D, E, and K. It's also essential for behavior and mood, and very important in depression and just having a balanced mood, that you're getting enough of the right fatty acids. And like I said, supplies fuel to the body. So how much fat should we eat, and what kinds of fats? So this is a breakdown here, and it talks about how we should have 44 to 77 grams of fat each day, 20% to 35% of our total calories. Most of it should be through what's called the monounsaturated. And those are the ones that I stress to my patients to eat more of, is the olive oil, canola oil, peanut oil, sesame oil, avocado. That's why avocados are so healthy. And most nuts are high in the monounsaturated. Then you also have polyunsaturated, which is a lot of your cold water fish, sunflower oil, corn oil. I don't recommend all of those as much, but the cold water fish actually very, very beneficial. And then animal fats, saturated fat should be less than 10%. That's your poultry, butter, ghee, tallow, and those are all good for you, but you just don't want to overdo that. coconut oil, palm oil, and I know there's been a big increase in people talking about eating coconut oil and palm oil, which are fine, but just remember that is a type of saturated fat, and we want to concentrate a little bit more on those monounsaturated fat. I use olive oil in pretty much everything, and I recommend you do that. Now, when you get fried foods, cakes, pastries, fast food, they have trans fats. And those are fats where the actual fat molecule is altered in a way that is not healthy, does not get utilized by the body very well. And really recommend, what does it say here? 0%. So the more fried foods you eat, the more unhealthy you are going to be. And pretty much everything in fast food. So I don't ever eat fast food, and I recommend that is just a very small portion, if any, of your diet. The British Journal of Sports Medicine stated that saturated fat does not clog the arteries. Coronary heart disease is a chronic inflammatory condition, the risk of which can be effectively reduced from healthy lifestyle interventions. Let's talk more about that. So there's a lot going on in this picture, but I'm just going to point out a high fat Mediterranean type diet where you're eating a lot of, like I said, olive oil, oily fish, nuts, vegetables. They eat cheese and yogurt. I think they eat more like goat cheese, which is actually a little more digestible than cow. A low in sugar and low in refined carbohydrates actually helps put the water on the coronary artery plaque. So you talk about, like I was talking about how the cholesterol forms on the inside of the blood vessels. If you eat this kind of a diet, you will prevent that. Also, regular physical activity, reducing your stress level, like through meditation and yoga, and not smoking. Smoking will increase the plaque in your arteries. That's one of the main negative effects of smoking. And smokers will almost always have higher pain all over their body because they have these plaques. It builds up arthritis in their joints, and it causes a tremendous amount of deterioration in the body, especially over years and years. When you eat those simple carbs and too much refined carbs, you see you have insulin resistance and systemic inflammation. So those are people that, like I said, have joint pain. They're very stiff. They wake up in the morning, can hardly walk. I'm sure you have people in your life like that, because this is a very common problem. Also, another thing that will be part of that is hypertension, so high blood pressure. And you want to have an increase in omega-3s, which is your fish oils, and less of the omega-6, which is in some of those other polyunsaturated oils that we talked about earlier. So you need them, but you just don't want a higher ratio of those two. Okay. So how much fat should we eat? It somewhat depends on your activity level. If your activity level is low, you're not going to need as much fat as someone who is a very active, athletic type of person. And it also will depend somewhat on how well you can digest it. So that dietary guidelines for Americans no longer specifies an upper limit for how much total fat you should consume. That doesn't mean that I want you to go out and start eating a whole bunch of fat, but it does mean that if you are an active person, and that if you're not getting enough of those healthy fats that we talked about, that maybe you need to eat more. So what are the symptoms of having too little fat? One is that you're hungry too much of the time, and you're eating throughout the day and you're wanting to snack. That's probably because you're not getting enough fat. You have dry skin. You may not be absorbing vitamin D and A, and you're not getting enough of the healthy fats. Because remember, we said that we have to get the fat soluble vitamins into the body. You might have mental fatigue, so brain fog. need to have more omega-3 to improve how your brain functions. And menstrual cycle problems. So if you're in menopause, it might not be menstrual cycle problems. It may be increased menopausal problems. Really, basically, that's the same thing because you're not making the hormones. And I went through my whole menopause with any HRT because I found out about these dietary guidelines pretty early on in that process. And I was able to change my diet and take supplements that helped me through that period. So I started out having a lot of symptoms, but as time went on, I decided I did not want HRT and I decided I prefer to modify my diet and exercise. And as time went on, it just got better and better over time. So I just never had to take the HRT. So the summary of the benefits are support your metabolism, signal your cells, health of various body tissues, anti-inflammatory, hormone production, absorption of nutrients, and hunger satiation. So if you're having problems with being hungry or eating too much, eat more protein and fat. Okay, what about carbohydrates? So here is where there's a lot of confusion, and carbohydrates are actually not necessary, but we're going to talk about the type that we want you to eat and the type that you should not be eating at least as much. These are the good ones: the resistant starch, which is starches that help slow down the processing of food within your system. So, simple carbs get absorbed very quickly. They go into your bloodstream. They cause spikes in your blood sugar. Resistant starch slows that down, as does dietary fiber. The resistant starch, though, is processed as carbohydrates in the body, whereas dietary fiber normally is more roughage, and it helps to form bulk in the colon, but it doesn't necessarily get incorporated into your body. Understand the difference? So resistant starch stimulates blood flow to the colon. It increases the circulation of nutrients. It inhibits the growth of the bad bacteria. Sometimes it's called prebiotic because it helps to improve the good bacteria. It also assists in the mineral absorption and helps to absorb toxins and carcinogens. So that's also very important. And that will help in our well-being quite a bit. The dietary fiber are ones that are indigestible, and they come in soluble and insoluble. You don't have to remember all these things, but it might include things like legumes, which is your lentils and peas and things along that nature, beans. There are types of fiber is oats. That's why you probably are told to eat oatmeal, rye, chia, which you can add to a lot of different things, barley, some fruits, and that's why a lot of people eat prunes for breakfast. You have figs, prunes, berries, bananas. All of those have an increase in fiber. Vegetables like sweet potatoes and onions and psyllium seed. So you can take the psyllium seed is a good, like Metamucil. You can take some in the morning just as a drink to get a little more fiber, because you really need a lot more fiber than you think you do. That's one of the things that I found in doing this research is I wasn't even eating enough fiber and didn't realize how much we're supposed to be eating or how much is best for optimal well-being. And flaxseed, nuts, and almonds, those are all very high fiber sources. So 25 to 30 grams a day. And one dose of Metamucil was only like 5 or 6. A lot of that has to come from your diet. So 25 to 30 from food as much as possible. And average American eats 9 to 15 grams. I think if you're eating 15, you're probably on the high end for most Americans. So what does fiber do? It's very important to maintain our youthfulness. And they found that older people who ate a fiber-rich diet were 80% more likely to live longer and healthier than those who didn't. And this was found in that study where they were looking at blue zones of all the healthiest people in the world and the cultures. There was one in Okinawa where all the people were eating a lot of sweet potatoes. And so then it came out, well, we need to eat more carbohydrates because they ate carbs and they're healthy, but they weren't eating simple carbs. They were eating very dense, fiber rich purple sweet potatoes that are high in antioxidants and high in fiber, which is very different the kind of carbs that we eat in our country. So what does fiber do? It controls your blood sugar. So like we were saying, you have blood sugar spikes. There are different things you can do. You can do the protein, you can do more fat and fiber. It improves your gut health. It helps you decrease weight because you feel full faster. So having some fiber before you eat is really important. And lowering your cholesterol, which we talked about, and helping improve your immune function. These are just some high fiber foods, which I did go over some of these already. You have a lot of fruits and vegetables, nuts, seeds. Those are kind of the main ones that you think about as being high fiber. So keep those regularly in your diet. A resistant starch is unusual, and it's hard for people to remember all of this, but this chart is a really good chart. A banana, when it's green, has high in resistant starch, but when it's really ripe, it's not. Then it's more like a simple carb. Oats, uncooked. So people that eat muesli, that is the oats that are not cooked, is high in resistant starch, but when it's cooked, it's a lot lower. So here you see down here, it says oats cooked is 0.5, but oats rolled is 4.4. I hope that makes sense. It is a little confusing. These are just some more fiber sources. One that I found that some of you may be interested in is this Mira fiber gummies. They were 8 grams of fiber, and they didn't have a lot of that, made with natural flavors. They're sweetened with juices and monk fruit, which is healthy, and they have some vitamins and minerals in it. I thought this was a really good option if you're not getting enough fiber, something that you can add to your diet. This Mira fiber, 8 grams of fiber per serving, pretty cool. And this is the soluble fiber, as we were talking about the difference. Whoops, going the wrong way. All right, so we're at the end. I'm going to summarize. Number 1, eat more organic because you want to eliminate those endocrine disrupting chemicals in your diet. Eat the right amount of protein, carbohydrates, and fats. And here's the ranges. The protein range between 55 to 90 grams, depending on your size, your activity, your digestion. And the way you figure it out is 1 to 1.2 grams per 2.2 pounds. And then eat the right amount of carbs, especially fiber and resistant starches. So you want a total of 25 to 30 grams of fiber from all those sources that we gave. You want to eat the right amount of healthy fats, and there is no upper limit. Recommended about 44 to 77 grams, depending on your weight and activity level. And we want more of it, most of it, to be the monounsaturated. If you're not getting enough of these healthy fats, like the fish oils, olive oil, butter, nuts, then I recommend just putting some olive oil on your vegetables. I use it on my salads. I just put it in everything. I make eggs, I use some olive oil. And I'm also using one of those vegan butters that has olive oil in it. And fish oil, you can either get it from eating fish once or twice a week or from supplements. And that's what a lot of people do that. I hope you enjoyed this introduction to menopause, aging, and food. And I don't want this to be given as medical advice because every woman is unique and these are general guidelines. But as we discussed, there are individual factors that you need to consider in terms of digestion, weight, hormonal imbalances, and more. And if you'd like a more comprehensive individual assessment and anti-aging plan, I recommend you take the biological age quiz to see how you're doing now if you haven't already done this, and then click the link to schedule a session with me if you haven't already done so. This is brought to you by Holistic Strategies for Eternal Youth, Menopause, and Beyond. And I appreciate you taking the time to learn more about diet today. Have a great day. Namaste.